I'm Dr. Remolina. I'm a physician practicing internal medicine, pulmonary medicine, and sleep medicine in Linden, New Jersey. Our office is located at 812 Norwood Avenue in Linden. Our office sees a variety of patients. A lot of the patients that we see happen to have obstructive sleep apnea. Obstructive sleep apnea happens to be one of the major causes of car accidents, and it causes morbidity and mortality in patients that sometimes are not aware of it. But our patients typically come from other physicians who consider the diagnosis of sleep apnea, and also from the families. Usually a wife will bring her husband in because she cannot sleep because he snores a great deal. And sometimes the wife is afraid that her husband is going to die because he will stop breathing and make loud noises. Sleep apnea presents in a variety of patients. Some patients are very, very heavy, and this is the bulk of our patients, but in some patients that are slim, it's still because of anomalies in the upper airway, they can develop obstructive sleep apnea. Obstructive sleep apnea is diagnosed in this office by doing a simple home polysomnogram. A polysomnogram means a sleep study. We will give you a little machine that you would put on your nose, around your chest, and a pulse oximeter in your finger. And if you can sleep with this for a few hours, we can get an idea of how much obstruction you have. If we are able to make the diagnosis of possible obstructive sleep apnea, we will send you for a full study. The full study will mean that you have a number of leads on your brain to determine the waveform of your brain, leads around the eyes to determine the movement of the eyes, a oximeter to determine the saturation of your oxygen, also it leads for electrocardiogram to determine the heart rate, leads around the chest and around the abdomen to determine the movement of the abdomen and chest respectively. And with this information we can determine how often you snore and how your snore affects your amount of oxygen in your system. If we are able to make that diagnosis, there is a choices of treatment that we can implement. It is important to understand that sleep apnea can kill. A number one cause of car accidents are patients that are overweight, have sleep apnea, and they get behind the wheel of either a truck or a car, and they fall asleep, and they will create devastating damages by killing others or doing damage to others as well as themselves. It is important to understand that a simple test can be easily done initially in your home to make such a diagnosis. So if your husband snores or you snore, consider talking to a physician about the possibility of obstructive sleep apnea. Treating obstructive sleep apnea would be extremely helpful. Patients feel 100% better, they're more productive, they have more energy. And by the same token, you will prevent a car accident or something that can cause damage to others. So if you're interested in sleep apnea, please go to our links or speak to your physician or call our office for evaluation of possible obstructive sleep apnea. Thank you for listening.